Okay, my name is Sonya, and in November I will be an oral cancer survivor for 2 years. A few years ago, approximately 8 or 9 years or so, my dentist found a spot in my mouth and we diagnosed it, and it was something called lichen planus. And he said, let's just watch it. It rarely ever changes over to anything. So fast forward a few years and I started having headaches and other symptoms, and we decided to do a biopsy, and it was stage 4 squamous cell carcinoma. Stage 2 here and stage 2 because it was in my neck, so stage 4 combined. And he referred me out to Courtney Shires, and she's my head and neck surgeon, and to the West Clinic, to Moon Fenton, and she's my oncologist. And they threw my plan together and decided to go ahead and do the surgery to remove the tissue from the inside of my mouth and free flap that with tissue from elsewhere. And it is 6 rounds of chemo and about 30 of radiation to my head and neck. And then after that, the cancer unfortunately came back in the form of a small cyst underneath my skin. They didn't even show up on the PET, actually. We did a fine needle biopsy, and then they did about a 20-hour marathon surgery and took some fat from my thigh and put it on my face, and this is part of what you see here. And the cancer came back after that, and we decided, after a second opinion from MD Anderson, that the surgery procedure was not working for me, so we enrolled in clinical trial. And the first round was 2 rounds of chemo and immunotherapy. And we did about 9 rounds of that and had a 75 to 90% response. And that was the end of that was in February. And then we did just immunotherapy after that. And I had complete response with no evidence of disease in June. And I'm proud to say that as of yesterday, I had my next CAT scan and it was normal with no evidence of disease as of today. So we will continue immunotherapy because squamous cell was so aggressive and it was in me. And we will continue that until after the 1st of next year. And then maybe talk about slowing down and see what happens after that. So life has definitely been a change. I work at the Hamilton Eye Institute. I see cancer patients, cornea patients, glaucoma patients, all kind of patients. But my heart, and I can empathize with the cancer patient because I know how they feel when somebody says you have cancer. So it's definitely been a feat to go through the motions of day-to-day life, and I'm a single mom. I've had a lot of help and support from my family and friends, and my sons were 16 and 11. And I have to say that because of them, that's what I fight for, not just for me, but for them. So, of course, I love my job, and that keeps me going daily. So we have to stay on the move and, try not to slow down too much, take a break when I need it, go to the beach sometime or somewhere fun. But people can live with cancer. I would like for people to know that it's not a death sentence and not to ever, ever give up hope. I mean, always keep fighting, always keep pushing and keep trying, because I'm living proof that you can live through something as aggressive as that, because as far as vanity, you can get through that too, because when I first started out, I had long blonde hair, and I certainly didn't have my thigh on my face, so it's been an adjustment, but it's been a good change.